Hi there, and welcome to another webinar provided by Crisis Support Solutions. Today's webinar, Helping Children Emotionally Cope with Coronavirus. And before we get started, just a quick disclaimer. You may have heard this in recovery rooms. The opinions expressed here are simply those of the people who give them. Take what you like and leave the rest. In other words, the information shared on this webinar is not a substitute for personalized professional treatment, therapy, and other interventions. Having said that, we are thrilled to welcome Dr. Brad Lindell, subject matter expert, president of the American Academy of Experts in Traumatic Stress. He's also a clinical and school psychologist with 30 years experience working with children, adolescents, adults, and their families. And we are so grateful that Dr. Lindell has taken the time to help us help children emotionally cope with this pandemic. Here now is Dr. Lindell.
To begin with, and then I really wanted to use this time more for Q&A. We all know that this is a tough time for all of us. We all got to adjust to new situations, very stressful, and testing all of our coping mechanisms. As we say when we're dealing with trauma, a lot of us are having a normal reaction to an abnormal situation. It's bringing out any personal issues that we may have, any relationships issues we may have, whatever family issues we have. If children have emotional issues, if they have behavioral issues, they're going to be intensified by this type of situation. Again, this is something that is unique. We haven't dealt with this type of situation before, and neither have our children. We're all worried about our own health and welfare. We're worried about, kids are worried about their parents, their grandparents. We're worried about finances. Kids are not going to school. Their routine, our routine is different now. We don't have the structure in our life like we've had in the past. Again, difficult to adjust to. One thing in particular for parents is they're now having to educate their children. A number of school districts, I don't know if in your locale, but in New York, school systems are shut down. They're likely going to be shut down for the rest of the year, which means parents are going to be taking on a lot of responsibility for their child's education. Teachers are going to have to learn a whole new platform of delivering education. So it's stressful, for everybody. And I know, one of the issues I'm sure we're going to address this issue is, children adapting and doing their schoolwork at home and following a routine and behaving. Those going to be issues that are going to arise from a situation like this. So I'm here. I want to listen to the concerns. I want to address the questions the best I can, and hopefully, my information will help in some manner, shape, or form to help us, navigate our way through this really unprecedented time. So, with that short opening, I do want to turn it over to questions. So, go ahead.
Excellent. Thanks so much. All right. Feel free again to add it in the chat box, or just go ahead, jump in, open up your line and ask any questions that you may have. Dr. Lindell, I'll get it started. A friend of mine asked me to ask you. I don't know if this friend's on the line or not, but I thought it was a great question. This child, I don't know if it was their child or just a hypothetical child, like they're asking for a friend, but the child, a kid, teenager, I think, is treating this like a holiday, like a vacation. Absolutely. Can't get them off the can't get them to focus on schoolwork, get them off the Xbox or whatever it is. Do you mind addressing how do parents deal with children at home and trying to keep them focused?
Yeah, absolutely. Very common issue, adolescents in particular, middle school and high school children, by nature, do not love school. It takes a lot of mental effort. takes their focus off of things that that they enjoy doing, like playing video games. So to them, this is, in their mind, a vacation time. And what needs to what really needs to happen here, and it's going to take time, in my opinion, and this is from my own experience. I do work as a psychologist in the school, and I see the transition taking place. The expectations have to be there. This is, again, a unique situation. The child feels like no expectations are there right now. It is going to depend on how the school is going to be delivering the instruction and what type of expectations the school is going to give for the child to, let's say, pass a course, to move on to the next grade. I know in my district, in discussions with them, child, it's going to go to a pass-fail type of situation. But for the child to pass, they got to complete at least 70% of the work in order to get that passing grade. So there's an expectation for the child that's likely to be communicated through the parent. The parent also is going to, need to set the expectation. And some parents are better than others at doing that. Again, depending on the history of the family itself, if parents do provide structure, if a child tends to be compliant, before this all took place, prior to COVID, they're likely going to be more successful. Remember that I said before, whatever issues are there tend to get intensified. So if a child would tended to be oppositional, not follow rules, not follow what the parent would say, that's going to be intensified in this type of situation, which is going to really challenge the parent to be setting more limits, in order to get more compliance. I would also, I know what we're doing here is we are telling parents to reach out to the schools, to professionals like myself, to help counsel the parents through this. So whatever resources they have available, because the school district still needs to provide a free and appropriate education. And that's depending on the circumstances. And appropriate has changed because of the circumstances. But they still need to, which means they still need to address the issues that may arise because the educational venue has changed.
Excellent. Good. We have questions that are streaming in, so I'm glad to ask on behalf. One of our participants asked, when children have a hard time adjusting to change, say 6 and 7 years old, how is it best to try to help them with this very large change in life? So adjusting to change.
One first thing that comes to mind with that, parental expectation needs to change in some respects. To expect a child to make this type of adjustment, especially children who might have a certain level of rigidity to their personality, they want things a certain way, it's going to be more difficult. But a new normal is going to happen. The longer this goes on for it, and like I said, I don't know what's happening in your locales, but in New York, we're not probably going back to school. So there's going to be a new normal. And, to help the child, to adjust by giving structure as much as possible, expectations, contingencies, you do A, B will happen. You finish this assignment that came from the teacher, you will get 15 minutes of video game time. The more structure that you can put in place, and similar structure that's been there before, having the child get up at a similar time during the day, not letting the child sleep until 11 o'clock, in the morning. Getting the child up, having some type of routine will help. It won't be magical, but we're talking about making things better. In psychology, we talk about improvement, frequency, intensity, and duration. Mm-hmm. We want things to move in a direction that the frequency of what we want, is better. or more. The intensity of what we don't want is less, and the duration of what we want increases, what we don't want decreases. That takes time, and it's not going to go from one to another um, over a short period of time. And that's where I'm saying that parents are going to need to adjust their expectations, because this is going to be not only difficult for the parent, but difficult for the child also.
Yeah, good. We have another participant who asked, I have a child who has a prior trauma experience. How can we best support her with this additional trauma?
Children who have individuals who have prior trauma are more sensitive, to new trauma. And like I said, what we bring into this situation is going to determine to some extent how we're going to react. I don't know the age of the child. I could talk in generalities, but support, validation of feelings, validation of safety, helping the child to understand factually what is taking place right now, what's likely going to happen in the future, but to be as realistic as you can because there are a lot of uncertainties, and to let the child know that what they're experiencing is a normal reaction to an abnormal situation. That if they're feeling more anxious, it's normal. They're not the only one. Everybody is anxious right now. You might be experiencing it more because this is something that has happened in the past with you.
Mhm.
But being as supportive as you can, as factual as you can, and and over time, hopefully, the symptoms will start to decrease as that new normal sets in,
Mhm.
and they
Mhm.
feel a sense of safety. Because the
Mhm.
trauma comes from a lack of safety, a feeling of
Mhm.
safety. Once the new normal starts to set in, hopefully the safety will also, that feeling of safety and
Mhm.
predictability will also set in.
Mm. Can you speak to, you and I talked about this as we were testing our mics yesterday. We get a little bit of a headache, a little dizzy, a
Yeah,
little this and that. Oh, I've got corona. Everything we're all feeling unsafe,
yeah,
right? Do you mind speaking to that?
absolutely. We're we're in a hyper aroused, hypersensitive state right now, um, where especially when it comes to the symptoms of coronavirus, um, we get a sniffle, our thinking goes to dark places,
Hmm.
or could go to dark places. We get a cough, whatever symptom it may be, uh, trying not to let your thinking and trying to be mindful of your thinking, not allowing it to go to very dark places and jumping to conclusions, because that's going to keep you in that hyper state of
Hmm.
mind. And if we can bring what's going to be best for everybody, if possible, and this is a lot easier said than done, but it takes a sense of mindfulness and reflection in order to take it down a notch. All right, we're all reacting and maybe not thinking about our reactions, um, just reacting to situations. And believe me, there's a lot out there to react, especially when you're watching the news, who tend to
Hmm.
focus on the negativity
Right.
that's going on. But to be mindful of what you're thinking and what you're experiencing, and do things that take it down a notch, and not only for yourself but your family and your children. Different activities, whatever you resort to, uh, as far as yoga, exercise, things like that, just to take it down a notch.
Hmm.
But just to go back to your original question, I digressed a little bit, is to be aware of your thinking, and
Hmm.
it's the symptoms are sustained over a period of time, and there's a worsening, and there's a combination of symptoms. So to jump to a conclusion right away, may not be doing yourself justice.
That's helpful. Thank you. And also to remind that's also normal. I'm a catastrophizer. So to remind like, okay, here I go again, let's brain that back in. Yeah.
Yeah, yeah.
Yeah.
It's and it, and it's if if someone has a predisposition, to catastrophizing, which is that
Yeah.
negative thinking, taking
Yeah.
a something and generalizing it into negativity or darkness, yes, you're going to be more likely to do it with something like this. And if just to be aware, it's not a
That's
cure
it.
all, but it's to keep the tone down a little bit,
Yeah.
the hypersensitivity down
Yeah,
as much
yeah.
as you can.
And knowledge is absolutely power. Another
Absolutely.
question is what's the best way to explain to a young child under 5 why they aren't going to school? They can't go to a museum, they go to the store. And I'll add to that because someone sent me another question about why they can't visit grandma, grandpa,
Yeah,
and those types of things. So, how would you explain that to a young child?
yeah. Well, giving as much factual information as you can, given a child's developmental level and their cognitive level. Certain children, just because of their age, or children because of their age, are able to understand things in a certain way. Uh, and if there's cognitive limitations, they can, it may damper their ability to understand. Be as factual as you can with a young child, to letting them know that there's something going on right now where people are getting sick. And what we need to do is we need to keep our distance from other people. Reassure as much as you can their safety, because all children, under 5 years old, their world is their family.
Mm-hmm.
Uh, Assure them as much as you can that they are safe, that the parent is safe, that they're taking all the precautions to make sure that parents remain safe and that they are safe. And one of the reasons that you're not going to museums or you're not going to school is because for safety purposes. And we don't know how long this is going to last, because we don't know.
Mm-hmm.
But there's going to be an end point, and that you will keep them informed. As far as grandma and grandpa, I do the same thing. Uh, I'd reassure that they're doing everything to keep themselves safe, and that's why we're not seeing them. If they can have any type of FaceTime with them or
Mm-hmm.
Zoom with them, to have some type of contact, because we are physically isolated doesn't need to mean we need to be socially isolated,
Right.
so that they can have some contact, so there's continuity in the relationship
Mm-hmm.
itself. But that you're not seeing grandma and grandpa
Mm-hmm.
to keep everybody safe. And children might hear things, like the elderly are more susceptible to getting serious illness or possibly death. Um, Very young children, you need to really define what elderly means, because most 5-year-olds believe their parents are elderly. So they, to really define that, what it is. And if, again, they're nervous about grandma and grandpa, you know, assure them as much as possible that they are taking every precaution to stay safe, so they stay healthy. And even if they do get coronavirus, it's not. I wouldn't use this verbiage with a 5-year-old. Of course, it's not a death sentence. It's
Mm-hmm.
still we talk about everything in probabilities. Yes, they talk about the elderly being more susceptible to death from the coronavirus, but somewhere it's around the 10% mark, and there's pre-existing conditions and things like that. So we're still talking relatively, uh, and I say relatively because 10% is a large number. Relatively, it's 9 out of 10 chance if an elderly person gets it, they're going to survive it.
Mm-hmm.
So
To piggyback on that question, I'm kind of skipping a few, but just to stay in that same concept, someone wrote that they have a friend, they're friends with COVID-19 in New York. How should they explain to their young children that they need to isolate when kids are in the same house?
okay, does one of the was I guess a child was exposed in some manner?
I'm guessing a parent or someone in the house has tested positive for COVID-19. So how do they explain to their kids that they need to isolate and can't be present with the child? That's the
Factual.
way I'm reading it.
Yeah, and again, it's being factual. Sometimes parents are afraid to give the truth, all right, because they're afraid of a response. But children, if they children are very good at picking up on if a parent is not exactly telling the truth, or is nervous about the answer they're giving, or doesn't get an understanding of what's going on. That gives them more anxiety. But parents naturally want to protect their child from experiencing anxiety. But truthfulness in this situation, over time, the child's going to do better if they know if somebody has the virus in the household, we are isolating them to keep you safe, to keep everybody safe, and to help them to get better. Because we're able to help them. If we're healthy, we're able to help them. And and they're going to get better, because I think if it's a parent in their 30s or 40s, the likelihood is over 99% they're going to get better. So it's pretty safe to say to a child, especially if there's no pre-existing conditions, that makes them vulnerable. You can say they're going to get better, but we just got to help them, the best we can. But the short answer to that would be to be as truthful as you can be.
Okay. We'll stay on the same young child theme for a second. I've got some coming in about teenagers, but how to help kids that 5 to 12 hearing snippets in the news or adult conversations that are not age appropriate and it's causing distress. You may have touched on this already, but if you don't mind, I want to make sure that people know I'm following their questions.
Yeah. I would try to shield children 5 to 12 years old, especially the younger, the 5 to 7, because their thinking is more black and white. They don't see the grays as much. I would shield them from the media as much as possible. We as adults get anxious when we hear things from the media, but we're able to filter in some respects, and we're able to understand that the media is going to focus on certain aspects of it, a lot of times more negative about it. And when children hear that, that's going to cause them anxiety again, because they're going to see it more in absolutes. I would try to shield them as much as possible. I would also try to keep the level of communication open with your child, that if they do have anxiety, that they're able to feel that they can speak to you about it. So you can clarify their thinking. You can clarify the information. So I would definitely recommend that. Also, to pay attention to your child. You know your child best of anybody. You know their baseline behavior. You know their baseline emotion. If you start to see a change in your child, they become more moody. They're not sleeping. They're getting angry more. They're being more, I don't know if I said, oppositional, not doing their work, which is not characteristic of them. Pay attention to that, because that may mean that that they need time to really express what their concerns are and their anxieties are.
Good. Thank you. Someone sent me privately a link and said that this was a really good article. So if you all also, you're professionals, if you're coming across resources as well, please feel free to send those, and I'll put those on our website and send that out and share that with everyone else. Another person asked if the child hasn't mentioned, like, everyone is sick, and they're just going through situations in their day, not really aware of coronavirus. That's the way I'm reading this question. Should you ask something specific about how they're doing with the coronavirus outbreak, or just check in just to see, they want to see if their child's just doing okay?
You can throw the hook out there. You know what I mean? See if, children respond differently. Some children, on one extreme, they internalize, they don't communicate. They're called internalizers. And we have children who are externalizers, who show whatever bothering them through behavior. And those are the two extremes. If the parent wants, they can throw a hook out there. And what I mean by that, bring it up, see where the child takes it. it would be, it wouldn't be what's expected given such changes. I don't know the age of the child, but I would assume it's a school age child.
Hmm.
Um, that there are not any questions going on because there's been large changes in the routine. But if there hasn't been any discussion, throw it out there, and again, remain vigilant to any changes in the child's behavior, emotion, sleeping patterns, eating patterns. Are they becoming more withdrawn? Are they acting out more?
Hmm.
So if the child's not going to verbalize, they might verbalize it or show it in another way.
Hmm.
That you would be able to, as a parent, would be able to pick up on.
Okay. Okay. Someone also sent me a question. And if I were a parent, this would be something that I would ask. My child is an overachiever and a perfectionist. How can I help support her emotionally and academically when I don't know anything about teaching?
Okay, that's a very good question.
I
Uh,
don't want them to know mommy doesn't know it,
yeah,
doesn't know math past the fourth grade.
yeah. Now, who's the perfectionist, the mother or the daughter?
I'm going to say the daughter. Yeah. Or, yeah.
Again, we're all bringing variables, personality variables into this situation. Some which are going to help us to adjust, some that are going to hinder us to adjust, and are going to test us in a number of different ways. Being a perfectionist in school can be an adaptive function, meaning they'll do very well in school, they'll learn very well, they'll likely get their work done. So those type of personality characteristics do well in that environment. In an environment like what's happening at home, it might not. So, the young child may not learn as quickly and as easily as they would like to. And it's going to be an adjustment to them. And it's going to be, again, I bring up the new normal that the child now is going to have to adjust their character, their personality, and their way of coping to a new situation. And it's going to be a struggle, and there might be, some acting out or emotionality, offering the child, support, helping the child as best as possible to verbalize. I know you like to get your work done. I know you like to get hundreds, and that's very, very important to you. Right now, under these particular circumstances, that would not be expected. You know, so to try to help the child to verbalize as much as possible. As far as the parent goes, as far as teaching, math and their anxieties, I'm hearing parents say more and more how they have an appreciation for teachers now.
Hmm.
More so because now they've been put into the teacher role, and they
Hmm.
see what that's like more. The parent, as much as possible, and school districts are going to vary, and on how much they're going to have assistance available. But I would say to the parent to reach out to the school district as much as possible. If the school district is shut down, uh, they still, like I said before, need to give a free and appropriate education. And appropriate has changed. The definition of appropriate has changed,
Hmm.
given this situation now. But to reach out for resources from the school, are there websites? Are there, can there be a telephone call if that's the way the teacher is delivering, the curriculum? If the teacher's available to that, um, try to get as much resources from the school as possible. So that's addressing the parent issue, the perfectionistic issue. That's a separate one that the parents need to help the child to work through. But
Hmm.
again, for the parent to adjust their expectations, because the child's having a hard time and they can't find the words to make the child feel better immediately, does not make them a bad parent. This is going to take time, and it's going to be
Hmm.
trial and error because this is totally new to everybody.
Hmm.
So as parents, we do want a lot. We see our child in pain. We want to address that pain. We want to
Hmm.
minimize that pain.
Hmm.
Sometimes it's just not possible, but
Hmm.
being available, changing expectation that this is going to be over time, will more likely lead to a more positive result for everybody. So
Hmm.
parents could be less anxious and the child will be less anxious.
Good. Okay. How important is it, psychologically, emotionally, and probably spiritually as well, to give, I say give ourselves a break as professionals, as parents, as friends, neighbors, to let ourselves off a hook? Do you see that a lot, that people put themselves on a hook, most of the time unnecessarily? And I mean that by putting pressure on ourselves to be either all things to all people or the be all end all, and recognizing, especially in times like this, how truly powerless we are, and the outcomes are we don't have any control over that. And I know that raises our anxiety. The opposite can be to release us from the things that we don't have any control over, and just recognize that. Does that make sense? Do you?
It does, and it goes back to changing expectation. A lot of our emotion is dependent on our thinking. If we have certain expectations and certain perceptions that we should make everything okay, we should make our children okay, we should shield them from everything that's going on with this, and they shouldn't have any, any difficulty or anything like that. And the thinking is, if they do, that makes me a bad parent. Or if they have, if they're having trouble over a couple of days, that makes me a bad parent. If you have that thinking, your anxiety is going to go up, your
Right.
guilt's going to go up. So, to your question, is adjusting thinking and adjusting expectation. Because if a person thinks to themselves or is able to accept and self-check their thinking and change their expectations to, this is going to be difficult for my child, right? I'm going to be here for my child to help them as much as possible, but this is a process,
Hmm.
and it's a process that's going to take time. That parent with that thinking is less likely going to be guilt prone and
Hmm.
anxiety ridden, which the
Hmm.
child's going to pick up on also.
Hmm.
Uh, so reflecting on thinking, being mindful of what you're thinking and how you're coming across, those are all things that are going to help in this particular situation, especially adjusting to extraordinary circumstances.
And does that level, I'm going to put that in terms of self-care as the grown up in the room, does
Yeah.
that help model for the child as well, that when I'm tending to my needs and recognizing I need to let go of things I can't control, that then models to the child about his or her anxieties as well?
That's a great point. Absolutely. Absolutely. Uh, as much as a parent can, they have to have their own routine. They have to recognize that they can't be a 24/7 parent right now.
Mm.
We have natural breaks in the day where we have alone time, whether it's driving to work, driving home from work, taking a lunch at work by ourselves. We don't have that as much now.
Hmm.
So for a parent to take self time and let a child have their self time, if a parent has a routine of exercising, of whatever the hobbies they may have, they continue to do that because, and again, a great point, because it models for the child that there is a certain level of normalcy right now.
Hmm.
It's an abnormal situation, but we can keep as much normalcy as
Hmm.
possible. So to have those breaks, which we all need as parents,
Hmm.
which are not naturally built into the day now because we're all at home, to mind, to purposely have that time, I think it would be positive for everybody and for the child to have that expectation that that's okay.
Good. Good, good. This is a tough question that was sent in, and they're all great questions. Please continue. We have some time still left. Our dog, a person writes, our dog died suddenly on March 8th, just as COVID-19 was ramping up, and our 10-year-old is having a hard time. We all are. It's another grief on top of so many others. Any advice on dealing with multiple griefs, multiple tragedies, multiple things at the same time?
Yeah. Uh, the loss of a pet. A colleague of mine did his dissertation on something called pet bereavement,
Mm.
and the process of bereavement with the pet mimics very much the process when we lose a loved one. And it could be devastating, to the family. They lost a family member.
Absolutely.
Uh, I don't know what the child brings into the situation as far as what their past losses were. Uh, but if it's a first loss, as we all reflect back on our first losses, it's a lesson in life, and it's an unfortunate lesson, and it's a difficult lesson. Uh, Speaking to the child about the grief that you're experiencing right now is something that most people would experience. Again, that normal reaction to an abnormal situation, and give them some perspective over time that the sadness that you experience and this grief you experience right now, that that will lessen, but the love and that feeling of loss, you'll have that, but it'll be different as you go, as the years move on. You will always have fond memories of the dog, but that intense grief you're feeling right now is a normal reaction. But over time, it's also normal that it dissipates, and the positive feelings that you had regarding the dog will remain.
Mhm.
You know, but giving a child perspective, on their feelings and what they expect going forward.
Is it compounded because, compounded stress that we're in the midst of all this uncertainty and chaos, and now another, now deeply
Absolutely,
personal event has happened?
absolutely,
Yeah.
absolutely. It's like anything, anything else. You pile. They're bringing some recent history into a very stressful situation, which
Yes.
is going to compound it.
Mhm.
So they're already emotionally raw, emotionally vulnerable, and now they have to start dealing with another situation that is very stressful. It's going to compound. It's
Mhm.
going to compound over time. All probability is that symptoms start to lessen, intensity, frequency, and duration over
Mhm.
time. Again, I don't know the predisposing factors. It would be under extreme circumstances that the symptoms would keep going.
Mhm.
Um, but if I can assume that somebody has a normal level of adjustment, that over time it's going to dissipate.
Mhm.
And again, support, perspective on feelings right now, and perspective on feelings going forward.
Very good, good. And Lori, we're sending out our love to you and your family during this difficult time. Boy, I get it. All my children have paws, so I'm my four-legged family here. So I get that. I'm sorry for that loss. So let's turn to teenagers. Ugh. Um, questions about teenagers are coming in. My daughter is sleeping later than later and later, and the teenager is in all caps. She's a teenager. How do we get them to talk, open up, and then get them up and active?
Yeah. Um, Again, it's the expectations that are there. There's nothing magical that I would, be able to say uh, that would get that child out of bed. But what I can say is that if there's an expectation from school, if there's communication from school that we expect a certain amount of work to be done, there are deadlines for the work, and the parent sets that structure, it's more likely going to lead to a child that's not sleeping till 11 o'clock, looking at this as a vacation, with really unstructured time, with no consequences to behavior. But if an expectation is there, it's more likely going to lead to the child, doing what they need to do. But again, if we're walking into a situation where the child has, before this all took place, did not follow rules,
Mm,
and tended to bend the rules, it's going to be a more difficult situation. But if we're bringing a child in, before coronavirus, was somebody who was academically oriented, follow rules, but now it's testing rules. Once those rules are put back in place, it's more likely that they can respond to those rules. So,
gotcha. Okay, good. How do I talk to college students? How do you talk to college students now that they're going to school online and they've lost their college jobs?
That's a difficult one. I have my son is a junior, Hofstra University here on Long Island, and he is now doing all online. Uh, what I've noticed with my son as well as in my practice is they're adjusting pretty well. And what I mean by that, what they have at their disposal today, college students, is they do have social media. They are able, and friends are very, very important. Peers are very, very important, and they're able to stay connected to their peers. I'm watching my son, video chat with, 10, 15 people online, almost every single night. Those are his friends, the circle of friends from school. So socially, while it's not optimal, they have a way of not being socially isolated, whether they're not in physical proximity, they're able to socially. Uh, there also, there have been college courses that have been given online. So to college students, uh, they are, that is not strange to them to have college online courses that they take. Uh, if they haven't taken one themselves, they know a friend who has taken one. So it's not that unique that they would have to do that. And I've found that they've switched over, pretty good. Where I think the biggest adjustment is going to be is their college experience. Because college is an expectation when you go away to college, that you have a certain experience and certain social experience, and that's what that's what they're not getting right now. And I think that's going to
Hmm.
be their biggest adjustment. Academically, if a child does well academically in a classroom, the likelihood is they can do academically. Do a college students can do okay online.
Hmm.
But it's that
What?
social experience I think is going to be the greatest adjustment.
Loss of job, what stress regarding loss of job, temporary loss of job?
I think that's going to be like anybody else. There's a lot of economic stress out there right
Hmm.
now, and they're they are going to have to deal with not having certain things, like we all are at this point,
Hmm.
because we're limited by finances. If they can, if they can find work elsewhere that that doesn't need to be on contact with somebody else. Nothing comes to mind immediately. They could try to get work elsewhere. There's no magic answer for that, and that again
Hmm.
is going to be an adjustment, and it's going to be dependent on the finances of the family. What is at their disposal.
Hmm.
What they picture they might lose by not having money. I mean, if
Hmm.
it's food and a roof over their head, that's going to be different from a child who can't go out and buy a video game.
Hmm.
So it's going to be dependent on the certain circumstances. Uh, but if we assume that they have a roof over their head and they have food, again, there's going to need to be an adjustment to an abnormal situation. They might not be able to just go out to eat if they want, or order in food if they want. They might not be able to get that video game
Yeah.
or order online, order something.
Hmm.
That is going to, they're going to need to adjust to that.
Yeah, we're psychologically, perhaps we were geared before this happened too. We want what we want when we want it. And now we're
Absolutely.
learning to live with limitations
It's yes,
by
and
no choice of our own.
no choice of our own.
Yeah.
And what I can say to that, and by no means am I going to look through this through rose-colored glasses, because it's a very, very difficult situation. But we are all being tested.
Hmm.
Some more extremely, and you never want to be tested with significant illness. You never want to be tested with death, you know, unexpected death, sudden death. No one ever wants to be tested by that. But what I mean by tested is not getting what you want when you want it. And that's pretty much all of us, all right?
Hmm.
Not being able to socialize when we want, not being able to go out, and testing our coping strategies, uh, to a point where there is growth from this. And
Hmm.
again, I don't want to put this through rose colored glasses by no means, but one of the ways we do grow is by dealing with situations and learning to deal with them, that are unique to us, that stress our coping strategies. So we have to, somehow change and adjust our ways of thinking, our ways of emoting, our ways of behaving in order to be successful in a particular situation. That brings on a new type of person after they come out on the other side of a new, unique, stressful situation.
Hmm. Good.
So,
Yeah. And maybe I want to get to this last question, but maybe also talking about, this is not the last question, but the importance of humor. I found people on Facebook right now, friends of mine, they're so funny.
I know,
And
I
it's kind of, I'm used to working with, first responders, cops and paramedics and firefighters, and they're kind of have a macabre sense of humor anyway. During tragedy they have a kind of a distorted but people are just so funny these days, and I think that's so important for us to maintain either some objectivity, some levity, to remind ourselves, yes, it feels like the sky is falling and the world is going into chaos, but the importance of
know.
finding the humor in things.
Yeah, yeah. No, it's. I would agree 100%. I would agree that that brings that level of tension down a
Yeah.
certain extent. What I spoke at the beginning, to bring it down a notch.
Yeah.
So when we see something funny, or it makes us feel better.
Yeah. Yeah.
So yeah, the humor is a good thing.
Yeah,
Is a
good.
good.
This was one that's been echoed, a question. A family member is working in the healthcare in hospitals, and their children, her children, are concerned about increased exposure. So, how is it that that we can talk to the children of those that are on the front lines working in the in hospitals right now?
Again, it's with children. It's a question of safety. If they feel that something is unsafe, like a parent being exposed, and that parent possibly being adversely affected health wise, or themselves, of course, too. The more they feel that, the more anxiety. There's realistic anxiety here. Right? We are hearing about healthcare workers who, because there are shortages and whatnot, that unfortunately are getting exposed to it. To be, as again, I don't know the ages of the children, but validate that your anxiety is real. And I can't take that anxiety away from you, but I can make it realistic. And what I can say is, we do have an adequate, if you do, you know, an adequate equipment in order to make sure that I'm safe. I am taking every precaution. All right. Maybe they need to keep distance from the parent in order to minimize, the children's exposure. But in a nutshell, I would say, validating anxiety, because you
Mhm.
can't take that anxiety away. It's real, but also giving them a realistic understanding of the precautions that are taking place.
I like that language of a real anxiety and realistic,
Yeah,
and making sure, from a fair, we talk about fairness in our training as, or distorted thoughts, is it fair,
yeah,
accurate, and true? And if it is, then
absolutely.
validate that thought. And if it's not, then we may have to reframe, and bring it back to a fair, accurate, and realistic perspective.
Absolutely.
But the fears
Absolutely.
out there are real. Absolutely. As long
Yes.
as we don't go to a catastrophic. Okay, so I'm asking, did we get to everyone's questions? And it looks, I haven't had any, I'm hearing people saying it's been helpful. Yeah, this has been great. And I will add to that as well. Thank you, Dr. Lindell.
Problem.
Knowledge is power. And just the fact that we're all together, and social distancing, but not emotional distancing, and knowing that there are helpers still out there that love each other. And we're here to help each other through this.
Very
Thank
good.
you very much.
My pleasure.
Really
Good luck to
appreciate it.
everybody.
Thank you guys.